CSTC loops and the neurobiology of worry. Dopamine and born worried. The second core symptom of anxiety disorder is worry and involves another unique circuit, CSTC feedback loops from prefrontal cortex. Symptoms of rumination, obsessions, and delusions are all types of recurrent thoughts. Neurotransmitters that regulate these circuits include serotonin, GABA, dopamine, norepinephrine, glutamate, and voltage-gated ion channels. Various genotypes of the enzyme COMT regulate the availability of dopamine in the prefrontal cortex and may impact the risk of worry and anxiety disorder and help to determine whether you are born worried. Warriors versus worriers. Normal controls with the MET variant of COMT have more efficient information processing in the DLPFC. During cognitive tasks, they have lower COMT activity and higher dopamine levels. But with the MET genotype, stresses can hypothetically produce too much dopamine activity, which actually causes insufficiency of information processing under stress and create the symptoms of anxiety and worry, that is, worriers. Under stress, Val carriers of COMT with their higher enzymatic activity are hypothetically able to handle the stress better. GABA and benzodiazepines. GABA is one of the key neurotransmitters involved in anxiety and has a regulatory role in reducing the activity of many neurons. And benzodiazepines act by enhancing GABA actions at the level of the amygdala and prefrontal cortex within CSTC loops to relieve anxiety. As discussed in previous chapters, GABA is synthesized from the amino acid glutamate via the action of enzyme glutamic acid decarboxylase and is transported via vesicular inhibitory amino acid transporter into synaptic vesicles, as is shown in this slide. And its actions are terminated by the presynaptic GABA transporter, also known as the GABA reuptake pump, and the enzyme GABA transaminase. There are three major types of GABA receptors and numerous subtypes. The three major types are GABA A, B, and C. A and C receptors are both ligand-gated ion channels and form an inhibitory chloride channel. GABA A receptors are targets of benzodiazepines, sedative hypnotics, barbiturates, and alcohol. The role of GABA C receptors is not well clarified yet. And GABA B are G protein linked receptors and may be coupled with calcium or potassium channels and may be involved in pain, memory, mood, and other CNS functions. GABA A receptor subtypes. Each subunit of GABA A receptor has 4 transmembrane regions. When 5 such subunits cluster together, they form an intact GABA B receptor with a chloride channel in the center. There are many different subtypes depending upon which subunits are present. Subunits of GABA A receptors are sometimes also called isoforms and include alpha, beta, gamma, delta, epsilon, pi, theta, and rho. And as stated, depending upon which subunits are present, the function of GABA A receptor can vary significantly. Benzodiazepine-insensitive GABA A receptors. These GABA A receptors are those with alpha 4, alpha 6, gamma 1, and delta subunits. But these receptors do bind to other modulators, namely the naturally occurring neurosteroids as well as to alcohol and to some general anesthetics. The binding sites for these modulators is located between the alpha and the delta subunits. One site per receptor complex called the allosteric site. And 2 molecules of GABA bind per receptor complex at site located between alpha and the beta subunits, sometimes referred to as the GABA agonist site. These GABA A receptors are located extrasynaptically and mediate a type of inhibition at the postsynaptic neurons that is tonic, in contrast to the phasic type of inhibition mediated by the postsynaptic benzodiazepine-sensitive GABA A receptors. The tonic inhibition may be regulated by the ambient levels of extracellular GABA molecules that have escaped presynaptic reuptake and enzymatic destruction. The tonic inhibition is thought to set the overall tone and excitability of the postsynaptic neuron and to be important for certain regulatory events such as the frequency of neuronal discharge in response to excitatory stimulus. Anxiety itself may be in part be dependent upon having the right amount of tonic inhibition in key anatomical areas such as the amygdala and the cortical areas of CSTC loop. If this tone becomes dysregulated, abnormal neuronal excitability could become a factor in the development of various anxiety disorders. Benzodiazepine-sensitive GABA A receptors. In these, there are 2 beta units plus a gamma unit of either gamma 2 or gamma 3 subtype plus 2 alpha units of the alpha 1, 2 or 3 subtype. Benzodiazepines appear to bind between the regions of the receptor between the gamma and alpha subunit. 2 molecules of GABA bind per receptor complex between alpha and beta units. These are thought to be postsynaptic in location and to mediate a type of inhibition that is phasic. Benzodiazepines acting on alpha-2,3 exerts an anxiolytic effect due to enhancement of phasic postsynaptic inhibition. Receptors with alpha-1 subunits may be most important for regulating sleep and are the pre-assumed targets for numerous sedative hypnotic agents. But currently available benzodiazepines are non-selective for GABAA receptors. Abnormally expressed gamma-2, alpha-2 and delta subunits have all been associated with different types of epilepsies. Benzodiazepines as positive allosteric modulators or PAMS. Interestingly, drugs that do not have benzodiazepine structure also bind to the benzodiazepine receptor. Thus, the benzodiazepine site is called the GABAA allosteric modulator site, and anything that binds to this site, including benzodiazepines, are called allosteric modulators. Acting alone, GABA can increase the frequency of opening of the inhibitory chloride channel. With benzodiazepine, this frequency increases. As the benzodiazepines are PAMs, when they bind to the allosteric modulator site, they have no activity if GABA is not simultaneously binding to its agonist sites. This action can be reversed by the natural antagonist flumazenil, but which can also induce seizures or withdrawal in patients dependent on benzodiazepines.